Namaskar. Today's topic is therapeutic index, also called therapeutic ratio. It is numeric value that gives idea about safety margin of drug for human beings. Everything is poison. Nothing is without poison. Doses make things not poison. Same principle is applied for the drugs. All drugs are poison. Benefit of drug depend upon doses. Means doses decide it is a drug or it is a medicine. Or if it is a medicine, then it is used for the medication to produce the therapeutic effect or beneficial effect. Here there is two words. Number one is drug and number two is medicine. These are the overlapping words and need to be differentiated. What is drug and what is medicine? Just to recall definition of drug. Drugs are substances that that is used to diagnose, treat or prevent disease or disorder of human beings. In pharmacology, we say drugs are substances that interact with the cellular constituents or cellular molecules or cellular proteins that play a regulatory role. Or we can say drugs are the substances that interact or that interfere in the physiological functions of the cells, and this interruption or this interference may cause blockage of the physiological functions or interruptions in the physiological functions or potentiation of the physiological functions. If any substance in stopping the physiological functions or interrupting the physiological functions or potentiating the physiological functions may produce toxic effect or it may produce the beneficial effect. Means drugs have both toxic effect and beneficial effect. Now come to the point, that is the medicine. Medicines are the substance that is used for the medication to produce the therapeutic effect. These medicines have therapeutic uses, therapeutic effect, but they do not produce toxic effect. Means any substance that produces the therapeutic effect and not a toxic effect, that substance is called, it is medicine. We can get confused that various drugs produce side effects, but there is a difference between the side effect and the toxic effect. There is another video that differentiates toxic effect, adverse effect, and side effect of the drug. I will put the link in the comment box. You can see what is the difference between the side effect, toxic effect, and adverse effect. Now come to the point. Medicines are the substance that produce the therapeutic effect without producing the toxic effect. This is the difference. Drug can produce both toxic effect and the therapeutic effect, but medicines produce only the therapeutic effect, not the toxic effect. Now, this therapeutic index can explain how a drug can be changed into medicines. By using the therapeutic index, we can change the drug into medicines. In this topic, there are few keywords like LD50, TD50, ED50, ED99, and TD01. First is the LD50. LD50 stands for median lethal dose, means the dose that kill or that cause death of the 50% of the animal populations used in the experiment. That dose is called LD50 or median lethal dose. Suppose we are performing the experiment to calculate the lethal dose by using 50 animals, and the dose that killed 25 animals, that dose is called, it is LD50. If we are using 200 animals, the dose that kill 100% of, the dose that kill 100 animals, that dose is called, it is median lethal dose or LD50. Similarly, ED50. ED50 is the dose of drug that produce therapeutic effect in 50% of population, that dose is called median effective dose or ED50. ED50 means it stands for median toxic dose, means the dose that produces toxicity in 50% of population, that dose is called TD50 or median toxic dose. Next one is the ED99, means the dose that produces therapeutic effect in 99% of population, that dose is called ED99. And last one is the TD01. Dose that produce toxic effect in 1% of population, that dose is called TD01. In these keywords, we are using lethal dose, toxic dose, and therapeutic dose. What is the lethal dose? What is the toxic dose? What is the therapeutic dose? And there another word, that is the subtherapeutic dose. Dose of the medicine or dose of the drug that cannot produce a therapeutic effect, that dose is called subtherapeutic dose. Dose that can produce a therapeutic effect, that dose is called therapeutic dose. Dose that produce a toxic effect, that dose is called toxic dose. And the dose that produce lethal effect, that dose is called lethal dose. Lethal dose always remain higher than the toxic dose. Toxic dose always remain higher than the therapeutic dose, and therapeutic dose always remain higher to the subtherapeutic dose. These are the sums in short explanation of this therapeutic index. Now come to the point, what is therapeutic index? Therapeutic index is ratio of lethal dose, median lethal dose, and median effective dose, means it is ratio of the LD50 and ED50. Higher the therapeutic index, higher will be the margin of safety. Narrow the therapeutic index, low therapeutic index means there will be the low range of the danger of the drug. Means that you will not save drug. If drug has a low therapeutic index, it means drug has low safety margin. It comes under the category of dangerous drug. For example, here on the board, there is one example. We are saying therapeutic index is the LD50 divided by ED50, median lethal dose divided by the median effective dose. Suppose dose lethal 25 milligram is the lethal dose LD50 and 20 milligram is the effective dose, that is ED50. The ratio will come 1.25. Take drug B. The lethal dose of drug is 100 milligram and the ED50 is 20 milligram. The ratio will come 5. Means drug B has more therapeutic index. It means drug has more safety margin than compared to the drug A. So this is the definition of the therapeutic index. Now come to the utility of the therapeutic index. We use this therapeutic index mainly in the three places. Number one, to select the drug. Number two, to decide monitoring of the patient. And number three, to decide dosage frequency of the drug. I am repeating. Number one is the selection of drug. Number two is the monitoring of the patient. And number three is the decide frequency of the doses. First, selection of the drug. Naturally, if we have two drugs, one has high therapeutic index, another one has the low therapeutic index, we will try to prefer the drug having high therapeutic index because that will be the safe for the human being. Second point, it has to decide monitoring of the patient. Suppose we have no option and we are using the drug that has low therapeutic index. In that condition, drug will be administered to the patient under direct medical supervision or direct under supervision of the medical professionals. Means patient must be monitored by the medical professionals if the therapeutic index of drug is very low. And third one is the decide the frequency of the dosage. Suppose the drug have low therapeutic index. In that case, we will give drug in a small quantity at the frequent intervals, at the different frequent intervals, so that it can produce minimum or very, very less lethal effect. If drug has high therapeutic index, in that condition, we can give the drug in the large dose with the low frequency of the administration, means once in a day or twice in a day. So these are the benefits, or these are the importance, or these are the utility of the therapeutic index. Now, is it correct or is it reliable to use the therapeutic index for these three purposes? There are some limitations of this therapeutic index. We are using the word median lethal dose, means LD50. LD50 is decided in preclinical animal studies. What is the LD50 of the drug? If it is decided on the animal, we cannot be extrapolate it for the human being, because LD50 for the animal will be different and LD50 for the human will be different. And obviously, we cannot perform the experiment of LD50 by using the human beings. We have no option. We can only calculate, only determine LD50 by using animals. And we cannot extrapolate this value or this data from animal to the human being. Means it is not a reliable. It is not a reliable source to calculate the therapeutic index by using the data of the LD50. LD50 is a controversial data and it is also not a reliable data. LD50 is performed by the using of animal, and drug produce slow poisoning, and that cause painful death of the animals. And this draw the attention of the animal rights activists. They oppose to perform the LD50 experiment by using the animals. To avoid this controversy, we should not use LD50 to calculate the therapeutic index. Result of the LD50 varies from animal to animal, from species to species. Means one drug may have different LD50. It will again create confusion. Is this LD50, which one LD50 should be used for the therapeutic index? Thus, it is not reliable to calculate the therapeutic index by using the LD50. To solve this problem, we are using the another parameter, that is the toxic dose, that is the TD50, that is the median toxic dose. Median toxic dose means what will be the definition of the therapeutic index if we are not using the LD50? Then the definition of the therapeutic index will be TD50 divided by AD50, means median toxic dose of the drug divided by the median effective dose of the drug. In other way, we can say the concentration of the drug in the blood to produce the toxic effect and the concentration of the drug in the blood to produce therapeutic effect, the ratio of these two parameters will be called as a TD50, or as a therapeutic index. Means here we are using the TD50 in place of the LD50. Again, this TD50 is also controversial. It is also not a foolproof parameter to calculate the therapeutic index. Reasons? There are three reasons. Number one, toxic dose is calculated by using the endpoints of the result. This endpoint may be blindness, maybe cancer, maybe diabetes, maybe nephrosity, etc., etc., etc. Means there are various endpoints that can be used to calculate the TD50. Now it will be difficult which endpoint should be used to calculate the TD50. Means this is also not a reliable parameter to calculate the therapeutic index. Second point, toxicity of the drug vary from person to person. Suppose person is sensitive. In that condition, a small amount of the drug will produce the toxicity in that person. If person is resistant, in that case, large amount of the drug will not produce the toxicity. Means this TD50 vary from person to person, and it can not be used to calculate the fair knowledge or fair idea about the therapeutic index. And at the last, in various books, you will see the graph that calculate the therapeutic index. Just I am coming to the board. Here is a graph to calculate the toxicity of the drug. Suppose this is the effective dose calculation, means this is the population and this is the dose. As we are increasing the dose, its effect is increasing, and at this point 50% of population will receive therapeutic effect of the drug, and this value is called ED50. Similarly, we are plotting another graph for the toxicity. Here is the population and here is the dose. As we increase the drug dose, there will be no increase in the toxicity, but so it will increase. At this point, 50% will develop toxicity in the 50% of the patient, and this value is called, it is the TD50. If we combine this both graph in one graph, this one is the therapy ED50 graph, and this one is the TD50 graph. And both graph is parallel in nature. In almost all books, you will find this graph to calculate the therapeutic index, and it is written a gap between the effective dose and the therapeutic dose. It comes under the category that is the therapeutic index. Means there are two methods to calculate therapeutic index. First one is the by formula, that is the TD50 upon ED50, or by using the graph. This is the ED and this is the TD50, and the gap between this ED50 and TD50 is called the therapeutic index. Now, it is misrepresentation of the fact. There is no scientific reason that the both graph will be parallel in nature. And if it is not parallel in nature, in that condition, it is not useful to calculate the therapeutic index. Means the graph we are seeing in the books of different books that is parallel in nature is incorrect representation or misrepresentation to know about the risk of the drug. That due to this reason, we cannot use the therapeutic index for the purpose of safety margin. These are the problems with the therapeutic index. To solve all these problems, we use another parameter, that is the ED99 and TD01. ED99 means the drug that is effective in the 99% of the population, that produces the therapeutic effect in the 99% of the population. That dose is called ED99. And another one is the TD01, means a drug that produces toxicity in the 1% of population, that is called TD01. Now we'll change the calculation formula for the therapeutic index, and it will come TD01 divided by ED99. If we are using the TD01 and ED99, in that condition, this requirement it should be parallel will not be observed, and this produce some sort of the information regarding the safety margin of the drug, that is the therapeutic index. If the value of TD1 divided by ED99 is 1 or more than 1, in that case we say it is a safe drug. If this value of TD99 upon ED1 is less than 1, then we can say it is not safe for the human being. And in this way, we calculate the therapeutic index that gives some idea about margin safety of the drug. Of course, it is not a foolproof therapeutic index, foolproof parameter to calculate the margin safety, but it gives a fair idea that if drug is toxic for the animals, then if the drug is lethal for the animals, then certainly it will be harmful for the human beings. There is another parameter that can be used as a margin safety of the drug, and that is called a therapeutic window, or we can say it is also called a safety window. To understand the therapeutic window means range of the dosage form that produce the therapeutic effect and not the toxic effect, that range is called therapeutic window, or that range is called safety.